Hello, welcome to the Dr. Paul Show. Thank you for joining me today. Today I'm going to be interviewing a woman who I've been working with for over 30 years. Her name is Kim Quickle. She's a psychologist, a marriage and family therapist, and her and I have shared a multitude of patients over the years. We've referred people back and forth many times over many years, and so I wanted to have her on because she's one of my favorite psychologists that I've worked with, and I have worked with many over the years. And I wanted to talk about psychotherapy and the role with treatment of patients. So it's really a pleasure of mine to introduce, I think, my favorite psychologist, Kim Quickle. We worked together for probably 30 years or so, maybe. So Kim, she works in the same building I do, upstairs. I'm downstairs. And since the show, you've heard me talk a lot about medications. It's what I do. It's my specialty. But I wanted to bring Kim in because she refers patients to me. I refer patients to her because I know it's not all about medication, that there's other elements. So I wanted to have Kim talk about what she does, talk about therapy. I wanted her to maybe go over the different types of therapy that are available, and also to help me to understand and to have the audience understand when's the role of therapy, what's the role of medications, and I know the statistics show that combining them together often does even better than either alone. But yeah, so if you could just start telling us what you do and why you're so good at it.
Oh, thank you. Thank you so much. It's a pleasure being here today. And I've been in practice for 41 years, and my license is an individual marriage family therapist. And so I practice psychotherapy with individuals and couples and families. And I believe in the benefits of counseling coupled with evaluations for medication, which Paul has been so helpful with because some people tend to give prescriptions out haphazardly. And Paul is very much invested in patient care and getting the full history and then evaluating whether medication is appropriate. And so there's types of therapy. I'm a cognitive behavioral therapist. So I work on when people come to me with negative thoughts, working on the power of positive retraining. And I give them an evaluation at the time of therapy on depression and anxiety. 5 categories of depression: no depression, borderline, mild, moderate, severe. If they're in moderate and severe, my experience is they're going to need medication. If they're mild, counseling alone will suffice unless it increases in terms of depression. In terms of anxiety, there's 6 categories: no anxiety, borderline, mild, moderate, severe, and extreme anxiety or panic. If they're in the last 3 categories, I refer them to a psychiatrist and or Paul to evaluate for the appropriate medication. And in combination, huge success. If we do counseling alone, talking is healing. People will get better. But if it's biochemical, if we do biochemical and psychotherapy, their results go like this. So it's highly effective. And sometimes people need a couple different options with medication, which Dr. Corona has been so helpful in evaluating and then prescribing. And if we don't have the first one that does it, he is like wanting the perfect equation, the wow effect. And then we go to a secondary medication. So I appreciate all that you do for my patients.
And likewise, and I love when Kim sends someone down. I get this evaluation sheet of anxiety and depression, and she has the rating on it. So it's really helpful because she's okay. This is 5 out of 5. This is like, okay, this is alarm bells going off. This person needs help now. So I mean, so I really appreciate that because she's already done her evaluation, and I'm sure I haven't seen her actual evaluation. I don't know which one it is, but whatever it is, it's very detailed, obviously, and so all these little questions that, frankly, I might not even have time to ask all those questions because there's so many that she's able to kind of meter out. Like, hey, this person is really suffering. And that's where I think, but what I found obviously is that a lot of people need psychotherapy, and a lot of people who aren't getting it need it. I think there's also, I've heard from you also that there's just having someone listen, and just listening to people and just caring and compassion, and just that can go a long way with patients. Just having them purge and having them get things out to a caring person like yourself, that can be very therapeutic right there too, can it?
Absolutely. So if there's two major functions of psychotherapy, one is a need to just purge, like you said, just vomit whatever it is that you've been stuffing, holding resentments, holding sadness, and get it out. And then the second function of therapy is problem solving. Someone comes with an acute situation, family trauma, and should I walk away from the family? Should I do a family therapy session? So problem solving with solutions. So two focuses: purging versus problem solving. And sometimes a patient may come in and one day they need to purge, and the next week they're into problem solving. Yeah.
So you get, and so if someone gets quick results, is there a point where you might say, I think you're fine now, I don't think you need to come back and see me anymore unless things take a bad turn? Does that happen?
Usually I'll say to the patient, how do you think things are going? Like today, someone came in and said, I'm doing so well. And I said, awesome. When do you want to schedule your next appointment? I empower them to make that decision. And they say, could I come back in a month? And I say, yeah, let's do a tune-up in a month. And then you can decide whether or not you want to be on call. Call me when you need me. Or if you want to do another month. So basically, some people start at once a week, once every other week, depending on that test that I give them. And obviously, if they're in severe depression and or anxiety, then if I evaluate that on the first session, I want them to see you. I want them to get an evaluation for medication, because I know all the counseling in the world is going to help because of talk therapy. But if they're biochemically, their neurotransmitters are out of range, we can do all the counseling in the world. But if they're not jumping those starts, we're not going to get to the best results that we could get.
Yeah. And I bet the purging sessions, there's a lot of tears, I'm sure. A lot of people have to let out all that, the emotion that they've been building up with.
Absolutely.
CBT, describe what is CBT, cognitive. It's the most common type of therapy given, I believe. What is cognitive behavioral therapy exactly?
Cognitive behavioral therapy is changing negative thoughts into positive. So let's say, for example, you come in and say, Kim, I am flying to Bali. I want a 2-week trip for free. And I'm like, you go, Paul.
Good for you.
And then they say, but you say, but I know my plane's going to crash. And you believe that to be true. That's the negative thought. So I counteract it with 3 positive truths. Number 1, I can't say, oh, don't worry, Dr. Corona, your plane's not going to crash, because I'm not God and I don't know that.
Mm-hmm.
But I can say this: you are more likely to get in a car crash than you are a plane crash. I can tell you that we've got 2 pilots on the plane that are brainiacs rather than 1. We get double our money worth. And I can tell you there's highly technological equipment to pick up on error. Those 3 positive truths are supposed to counteract your fear that your plane's going to crash. That's cognitive behavioral therapy.
And is what's like exposure therapy? Is if someone like have to like pretend they're sitting on a plane, like people that, I mean, flight phobia is extremely common. One of the biggest most common is fear of flying that I see. Fear of dying, I think, is number 1. Fear of flying is right there, and in public speaking, those are the top 3. Is like exposure therapy? How's that different?
So it's not really that different, because like with Toastmasters for fear of speaking, you throw yourself into it and you have to talk yourself into the positive. If I do this, I'm going to get better. If other people are in the same boat as me, and I'm just going to do it one time, and if I die from it, I'll never go back. That's cognitive behavioral. So exposure therapy started with kind of like throwing you into the element. With fear of flying, what are your fears? It's usually control. And when you get on a plane, you're out of control. And many people who have OCD suffer from that. So we're going to go to the airport. We're going to sit in a car. We're going to watch the planes go off. Then we're going to go in the airport before COVID, and you could sit and watch planes in the airport. Then I'm going to have the airlines, which do this, and let you walk on an empty plane. And then you're going to get in a seat, and you're not going to fly alone. You're going to take a support person with you to help you get, and ideally, nothing bad happens and you've kicked it.
And I like what you said before about letting the patient guide you. So for me, for example, when I see a person, I may follow up with them 2 to 4 weeks, then maybe another month. It normally takes me no more than like 1 to 3 visits to figure out the meds. And then all of a sudden, if I'm doing great. Okay, let's, what? I think we can do it 3 months. So you've already doing great. Let's do 3 months. And there's some patients I see, you know what? You've been doing well for so long. Let's do it 6 months. I mean, I do that with patients, and then they'll say, if anything happens, anything changes, I'm here. But that's what I think what happens. I think when you get people better, it's great to see that, obviously. I'm really interested in what is EMDR. You don't do that, right?
I don't do EMDR, but it's fascinating and it's so beneficial for trauma victims. So basically, when you've had an acute trauma, rape, you witnessed a murder, you've survived an airplane crash, and so what the therapist does,
war veterans, and
and so the therapist will walk you through the trauma, but while doing that, preoccupy your brain with doing things like tapping or doing this or doing things so your brain can walk through the trauma while it's preoccupied with other things that help you process the trauma without it being full bore.
What's this like right brain, left brain, right brain, or something with the light or whatever?
Yeah.
Is it because you see with the right brain you see certain things, and with the left brain you see? Is it have to do with that? With the?
It's more about preoccupying your brain while you're talking through a trauma.
Okay. Yeah, I've seen some. I see a lot of veterans. I get a lot of veterans sent to me, even like Vietnam War veterans, even. And
very helpful.
And the Persian Gulf War veterans, and I see a lot of them, and it's really, really helpful in some of these people. Like I said, rape victims, child sexual abuse victims. all these like really extreme traumas. How about dialectical DBT? I mean, I know probably the most challenging patients for you and for me, and in general, is probably we call Axis 2 diagnoses, which means personality disorders. Axis 1 means like the depression, anxiety, bipolar, things like that. Axis 2 basically means a broken personality. For example, narcissism, histrionic, borderline personality, sociopaths, psychopaths. Borderline personality people can be very difficult. Their lives are chaotic. They cause chaos in their lives. They cause chaos in our office's life. They're just tough people. Do you deal with borderline patients, and what is actually DBT, and how does that differ? You're aware of?
So DBT is talking very rationally and supportively. Borderline personality disorder, narcissism are severe personality disorders. And sometimes they're tricky where we don't know at the first visit that we have that severity of personality disorder. And then as it unfolds, the prognosis is poor. There's no recovery. But with support and unconditional empathy, you talked about that earlier today. Empathy means I hear you, I feel you, your pain, and let's figure out how we can work this out. And that seems to kind of dissipate the negative characteristics of their personality disorder. And long-term treatment is necessary, but most will not support long-term treatment.
Right. And that's what I've seen too. And there's another psychologist I work with, Sam, very well.
Yeah.
Sam told me, well, Paul, it's like, it's teaching them to be human. That's what it is. He said, teaching them to act human. Because I think it's what happens with the borderline patients, their extreme immaturity. It's almost like they're stuck in a perpetual adolescent mode of thinking and behavior, and they just can't get out of it. I mean, I have had, interestingly, with DBT, I've had some patients actually do quite well. But see, the one that did and comes to mind who did really well is really got into it and really studied herself. So there's some books out there. There's a book called I Hate You, Don't Leave Me.
Yeah.
Which is that tells you a lot when that whole title, I Hate You, Don't Leave Me, is like, whoa, okay. Walking on Eggshells.
The book Stop Walking on Eggshells is a must if you have someone in your life with borderline or narcissism or both. And she read both books, and she said, I started to understand myself, and I started to think, why am I doing this? And then she really kind of traced it back to her childhood, her parents, her mom. And she's like, I think I understand why I'm like this and why I'm having so much difficulty with relationship. She basically did a lot of her own. She did go to some therapy sessions, but then after going to therapy sessions, she said, I'm going to study this on my own. And she ended up doing that and reading and studying and she said, I looked for everything I could read about BPD. And she said, I finally got myself out of it. And it was, she used to be a brat as a patient. I mean, she used to be, but now she's pleasant. She's still a patient to this day, and she's doing really, really well. It's very unusual. You will not hear a lot of stories like what you just said. So
it's very rare.
Story.
Narcissism is also, it's usually men. And it's very difficult to fix a narcissist. Like I said, you can change biochemistry with meds. You can therapy problems with CBT and other forms of therapy, But to change the personality of someone is getting to the core of that person, and to change the core is very difficult.
Yeah.
To make a man who's a narcissist and not a narcissist is a challenge. The most challenging, and the histrionic is challenging too. But probably the most challenging of all is sociopaths. And there's a really good book out by Dr. Martha Stout. She's a psychologist trained at Harvard, and specializes in the subject. And she wrote a really good book called The Sociopath Next Door. It's a really good book, and she talks about sociopaths. It's not always what you think. It's not always the murderers and the rapists and the criminals. That's the easy. The psychopaths and the sociopaths that are criminals, or even white collar criminals, people who rip people off, people who rip old ladies off, and those are sociopaths. But they can be people that you would never think in the community: bankers, pastors, people you would never ever think that are just evil. And she basically says the way to summarize it is they have no soul. And it's like, wow. And she goes, and she said her recommendation is stay away from them. Don't engage them, even if they're family members. Get them out of here. Don't look back. Don't try to engage with them, because they're gonna destroy you. And the same you can say with narcissist. And now, if you have a narcissist sociopath, that's really bad. But anyways, if anyone wants to read that book, it's in my new book. The Corona Protocol. I talk about. I have a whole chapter. Well, I have a whole section in my book about personality disorders. I'm fascinated by the topic. I think it's a really interesting topic, and so. But I talk about each of the personality types of those four I just mentioned, and so if you want to get more into it, you can read the sociopath story in my book. It's pretty creepy. I won't ruin it for you, but it's pretty disturbing. Anything else you'd like to share with us? I mean, I think, for me, it's recognizing, like, when I'm seeing someone with medication, when I treat someone with medication, if they're doing great, and I'll try to screen it. I say, tell me about your relationships, your family. I get to know people really, really well. They become friends. I get to know them really well. But so when I get to the point where I'm treating somebody, but there's still something going on, there's relationship things going on, there's a problem with their kids, that's why I send them to you, because I was like, there's something beyond the medications that I'm not reaching here, and that's where I think maybe psychotherapy comes in, is when, like you said, when there's family problems. And we see a lot of, there's a lot of dysfunctional families out there. Do you see that a lot?
Yeah, and just to address psychotropic medication combined with therapy. Many people are misinformed and uneducated about medication. So I always tell them it's non-narcotic and non-addictive. And it's like a vitamin for your brain. When your neurotransmitters are off, we'll do all the talk therapy in the planet. But if that's off and we don't address it, we're going to miss something very substantial, like a diabetic not taking insulin, or a cancer patient not taking chemo. And what I love about your work, Paul, is you don't just write a prescription and say, go your merry way. You support them doing talk therapy. So it's not just about the happy pill. Mm-hmm. It's about, let's get this balanced, and then let's have you do behavioral changes to make your life better. Mm-hmm. And that's why I love working with you, because you support the combo. And that's what I do as well.
And then the fact that there's some psychologists, I think, who don't understand medications, and they think that just talk therapy alone. And again, talk therapy is extremely important. And I talk to people about exercise and eating right, and all those things are huge. And how to relax, how to relaxation techniques and breathing and all that stuff is really important. But I think I think medications are, as you say, very misunderstood. Those are the exact same lines I use. Brain vitamins, balancing your brain properly. People say, well, is it all in my head? I say, yeah, it's in your head because your brain's in your head. So yes, it is. And you're not crazy. When these are not crazy pills. You're not a mental patient. You're not. All these people that think I'm psycho. No, you're not psycho. Mm-hmm. The fact that you're getting help is a sign of strength. It means that you're showing your strength, that you know you need help and you're seeking it. I said, and I tell them this all the time, that the fact that you're facing it and head on that's a great thing, because I tell people it's important to them to hear it. This is not your fault. And when you tell people it's not your fault, it's very powerful.
Absolutely.
And it's like, because they feel so guilty, like, what's wrong with me? What am I doing wrong? I'm such a loser. I mean, and they start doing that negative self-talk, like you say, and because of the fact that, how come I can't be like my sister? She's the perfect child. I'm the black sheep, and people get that negative talk going, and realizing that, well, unfortunately, what happened with you got a bad genetic load. Your sister took more after your mom, who's healthier, and you took more after your dad, and your dad has more of a history. So sometimes it's a genetic thing you can't help. And this is why maybe one sibling has it and the other sibling doesn't. And it's because of the fact that genetics and upbringing and socialization in school and all the other things that come into it. But that's, a lot of my work is, not just talking about medications, but is talking to people and trying to figure out, okay, is this a good person that we should see a therapist or not? And that's beyond my pay grade. And when it gets to that point where there's a lot of other problems, it's like, okay. And then people will come and see me and go, oh, you're such a good listener. Can you do psychotherapy? And I go, no, I don't do psychotherapy. Why not? I said, because I'm not a psychotherapist. I'm not trained. I'm a doctor. I'm an MD. I haven't trained to be a psychotherapist. I took some psychology classes in college. That doesn't count. That's not enough. You have to be you got to go postgraduate. You got to actually put the schooling in but I said, I'll listen to you, and I care, but I'm not a therapist. She's not a doctor. She's not an MD. But we each understand that there's a role for both, and that and to understand that is very powerful, because when people get both of our helps, it's just amazing the results that we see, in our patients.
I always tell people, I don't worry about the people that come to me. I worry about all those people out there that refuse to get help when they need it.
Mm-hmm.
And I'm on the second level, and in the morning we watch, and all the postal workers play hacky sack.
I've seen that.
They do that, and then sometimes they'll do Tai Chi. And I like those postal workers are when they're doing things so they don't go postal.
Yeah.
Right?
Yeah.
So we all got to take care of this.
Mm-hmm.
And with all that you do and with psychotherapy, I think the prognosis is very good.
There's a lot of, you can speak to this. There's a lot of relational problems out there. You do family therapy, you do couples therapy. There's so much, there's so many problems out there with relationships and with families. My family, there was a bad split, so I personally know how that feels and how it goes. And, but that happens so often, can you speak to that?
Sure. Family therapy. So some people come to me individually, and as a result of that, after a few sessions, it unfolds that when you think about how many hours we spend with our families or in our marriages or couplehood, if that is dysfunctional, that's going to impact one's peace.
Mm-hmm.
So if you get better, but your system stays dysfunctional or toxic, then we're going to have a problem. So most of the time, I have to refer out to another therapist, or sometimes this person has advanced and I'm ready to do the couple counseling.
Mm-hmm.
But it's an integral part of success is doing that part of therapy.
Yeah. And by the way, to clarify, the family, the Discord I'm talking about is not my own family, not my wife and my kids. It's my, my
family of origin.
Family of origin, exactly. And that that's gone poorly. And it's probably broken, but anyway, is it fixable? Who knows? We'll see. But it's common, and I just see, and I think COVID made everything worse. I think there's been a lot of damage done with the pandemic. I think there's a lot of breakups. There's a lot of problems that mental health problems that caused, and so that's been, I think, mental health problems. The crisis has really worsened during that couple few years there. With schools closing and all the ridiculous rules that were put in place that were very damaging, and I see with kids too, the mental health crisis in kids with being out of school and lack of learning, and it led to a disaster, increased suicides, so many problems that we're seeing. So. Well, ending on that sad note, but I'm just so thankful for you to come in, Kim.
Thank you.
Love working with
having
you,
me.
and I hope we work together for many more years.
Thank you.
You're not retiring anytime soon, are you? I hope not.
I will never, unless the Lobster Shack goes crazy, and then I got to work at the restaurant instead.
Oh, by the way. A quick plug for her and her boyfriend Dan own. It's called the Lobster Shack. It's right over here, a block from my office in Laguna Niguel. It's fantastic. They make lobster rolls, shrimp, crab rolls. The amazing, their coleslaw is the best coleslaw I've ever had. The soups, the clam chowder, all the soups they have are amazing. So, anyway, if you have any,
you didn't have to plug that.
I gotta plug it because it's so good. And Kim brought us food today too. So anyway, but thank you, for that.
All that you do.
And then again, Kim Quickle, if you want to see her, she's in Laguna Niguel.
Thank you, honey.
Thanks, Kim.
Thank you.